joining in. Yes, okay. So, a very warm welcome to everyone who's taken out time on a Sunday afternoon to be here to listen to me. I hope my voice is audible and clear and loud enough. So, I
Yes,
am
ma'am.
also COVID positive right now, and my throat is not very, very good, but I've kind of taken all the precautions to keep it going for 1 hour. So, how we'll do it is I will present my screen and I will make a short presentation, and then we will keep the floor open to take the questions. And I think Samriddhi is the moderator to take the questions. So if you do have any questions, thank you, Saloni. If you do have any questions, you can put it in the chat box, but it will be easy to take the questions at the end of the session so that the flow goes on well. Otherwise, I will be disrupted in my presentation. So allow me a minute to share the screen, please.
Sure, ma'am.
Okay, so guys, is the screen visible?
Yes, ma'am.
Okay, so great. So let's take it here. The topic for today that was assigned to me was wellness of mind, a very, very important necessity during COVID-19. And here I would just like to, share a thing that I just read. And it clearly said, this reading that I was doing today morning, this is a quote given by a researcher, and he has written, don't wait for things to get easier, simpler, or better, because life will always be complicated. It is important that we learn to be happy right now, otherwise, you will run out of time. And this, I think, I wanted to start off with by saying that life is full of complication, certain things that we expect, certain things which are uncertain, and COVID has been that one pandemic that was absolutely uncertain. It has no warranty guarantee card. We don't know when it came exactly, we don't know when it will completely leave us, but we have to live with it, and we have to make sure that we live with it with a good, strong mental health. So, starting with this, we want to understand that what is mental wellness. So, mental wellness can simply be defined as a very, very simple state of emotional and psychological well being, wherein every human being is in that able and stable state to use his or her cognitive and emotional capabilities. The word cognitive here refers to your thinking. So, are you in that state of mind that you're thinking straight and you are using your emotions appropriately? We need to do this because we want to function in society as individuals, and because it is a requirement of our everyday to day life. Mental well-being is also absolutely important, because not only is it a vital part of our lives as much as our physical body is required to be healthy, but it also impacts your thoughts, your minds, and eventually your behavior. So if you are thinking correctly, if you're feeling okay, your thoughts are going to be properly aligned, your behaviors are going to be appropriately adjusted to society. And on the other end, if you're not thinking well And if you're thinking in a pessimistic, negative way, your emotions are going to be aligned negatively, and obviously we will get into certain behaviors which are maladjusted to society and which are basically offbeat from society. So, to live a very productive life, to live a life of effectiveness, to play our role that we are born with, so our roles change in life. So, we are born to play these different phases and different roles in our life. We need to keep our mental health strong. We need to adapt to changing time. And, like the quote said, there is never a day on the calendar where we say today is the right day, every day is the right day. So right from the beginning of pandemic, the COVID pandemic, we have seen that there has been a lot of changes. We read every morning, we read in the newspaper that cases are rising in some cities, cases are going down in some cities, and we read that we are probably in the third phase, which might get worsened by the end of Jan, first week of Feb, and there's overload of information. So this pandemic has definitely affected our mental health. It has posed a lot of challenges, and simple challenges to talk about is this word social isolation. This has dropped the mental health of every individual because we have been forced into purposeful isolation, whether it is in terms of quarantining, whether it is being in terms of disconnected from your family members, whether it is the word lockdown. We are scared that which day we read the newspaper that there's a complete lockdown. Right now we know that there is night lockdowns, etc. So your restrictions come in movement, your restrictions come in sharing your day-to-day life with your family members, friends, etc., which has pushed people to a state of helplessness, because if it is a government rule you can't do anything about it. So there is a state of feeling helpless, there is a state of feeling sad, in other words grief, and of course resulting in a little bit more serious scenario with anxiety, depression and loneliness in terms of isolation. So this demand has been there on everyone, more so health support workers, and we can understand that we have seen during the first phase and second phase how many COVID warriors have put in what kind of time, what kind of energy across the world to help people deal with this pandemic. Of course these health workers have not only gone into a lot of physical hardship, but a lot of psychological distress, because fear is something that everyone feels. So the fear inside the PPE suit, the fear of not knowing what is happening with your family members because you are not allowed to meet them for days at end, shortage of qualitative personal protective equipments in India over here, of course not getting enough leave and not having proper management, because this was something which was so uncertain that we didn't know how to deal with it. I'm talking right in the first phase. So looking at health workers, they have had their phase of difficulties, but let's move towards the difficulties that the students, the teachers, the school counselors, the school employees and school students have gone through, because we have seen the worst affected area along with the financial sector in India has been the academic or the education sectors, where children and adolescents have been deprived of the normal school life as a result of lockdown. Now, when we're looking at the unprecedented challenges that the school kids and the adolescents have faced, is one, majorly moving from offline classes to an online format. Now, online format was not a difficult thing when it came to that, as much as that people don't know how to use a mobile, or people don't chat on WhatsApp, or people don't know how to use Facebook or Google. But the difficulty came in where it was expected of students to be at home within constrained spaces, to be attentive in class and learn their online material, and of course for difficult for teachers in process of providing a very equitable access to every student sitting as far as possible in every nook and corner of the country. Now, it has been difficult also for teachers because their educational needs, their reach out to students, their learning new platforms of how to use LMS, and different platforms to reach out to students, keeping students involved amidst all this uncertainty has become very difficult. So if you remember that when pandemic hit our country, of course teachers were put in for training programs with different, taught, we were given workshop trainings how to use different portals to teach students, but not many courses were made to actually show us the empathetic touch point that when a student is sitting in front of a camera, how do you motivate the student to keep the camera on through and through every day? How does the student feel motivated to get, involved in the class, to put in initiative? This has never been a part of any formal workshop, and so it has been a very, very difficult learning phase for students right across school, colleges, higher education, and as much as it for teachers. So this is a very latest statistics, guys. Is the screen clearly visible, students?
Yes, ma'am.
Okay, so if you look at the statistics here, and we see that across 300 million people in the world, this is the data that I've got from WHO, which says that 300, approximately more than 300 people across the world, million people, have suffered under and are suffering under mental health issue. And if you see that the percentage in mental health, we are going to be talking about 18% of them suffering from diseases like depression and anxiety, which is a very high percent, 18%. That means that there are a lot of people in the world who are suffering from anxiety, people who are suffering from depression, and nothing is really being done. If you just look at the GDP of India, just 0.06% is spent on mental health issues, because people have not given importance to it right till pandemic came in, and now everyone's talking about it, everyone. And I mean, you can see out of 300 million people, around 7% are Indians who are suffering from mental health issue, and we are absolutely in shortage of psychiatrists, psychologists, counselors, because again the need for these professionals were never felt this strongly as much as when the pandemic hit our country and the world around. So it is statistics which makes you think and recognize that what is stress all about, what is this pandemic doing, why is there so much of worry, and what are the different challenges, and what is typical. So basically we have seen that along with your different work, so work from home, nowadays we've even come up with the short form WFH. We do see that these are situations which were beyond the ability to cope. So in psychology we define stress as anything that poses a threat on our ability to cope. So today you are standing on the bus stop, the bus has not come, you have to reach college for lectures, you wait for 5, 7, 10 minutes, and then you just decide to stop an auto, or take a hike and just take a lift, and you decide to go to your college on time by taking the option of taking the auto. But that is because you have the ability to take the choice, you have the ability to cope up. But pandemic has been such a situation that people didn't know of how to deal with these challenges, and that has caused us to suffer from several mental health concerns like anxiety and depression. Because when we are suffering from anxiety, when we are getting one of those panic attacks, we don't know what we want to do, people don't know how to handle. So I just want to discuss some symptoms of anxiety, and these are symptoms of coronavirus anxiety. So by profession, guys, I am a clinical psychologist. I work in a mental hospital in Bombay, and of course I am also a lecturer in psychology. So anxiety is a severe mental disorder, it is a psychotic disorder, and it is a disorder where people suffer from panic attacks. Patients suffer from panic attacks. They suffer under the vulnerable state of feeling scared, and there are different kinds of phobias that people develop. But here we are going to be not talking about anxiety disorder as a general psychotic disorder. We are going to be talking about coronavirus anxiety. Now, coronavirus anxiety, I am sure all of you have seen people around. Like, I'm telling you that I am diabetic and I had taken both my shots in time, but I have become paranoid myself. I am so anxious to touch any surface. So, it's like when I have to touch the elevator button, I have so much of difficulty to put my finger on it, and I keep trying elbows and my knuckles and this that, and people look at me and sometimes think that, okay, you're really a psycho because, so what, now just press it and sanitize your hand. But I am just scared to go out in public. I'm scared if anyone comes and stands around me. I am scared to go to crowded public supermarket, but I need to get to a normal life. So this anxiety that is set in me, makes me hyper vigilant. Okay, so if I see anybody's mask a little lower than the nose, and I get really upset. Like when I walk in college, I see a lot of times students standing and their mask is, the mask is hanging somewhere in the chin area, and I get so angry and I tell them, वो mask निकाल के आप लोग पायल के जैसे पहन लो ना, हाथ में पहन लो, elbow में पहन लो, and they look at me and they're like, is she mad, like what's the big deal. But I have become hyper vigilant. Of course it is difficult, not to be, but I'm always thinking of it in the night. So I have difficulty in sleeping, I have excessive sweating, and when you have a panic attack, you have a lot of thoughts racing down your head. What if I'll end up in ICU? What if the virus enters my lungs, etc. So it's just that this has affected a lot of people, where we've heard of this saying, empty mind is a devil's workshop. तो जब हम घर पे बैठे रहते हैं और पूरा टाइम हमको यही हम सोचते रहते हैं कि क्या होगा अगर मेरे को वायरस लग गया, क्या होगा अगर ये हो गया, you keep thinking, and you have a lot of negative thoughts coming in, you have restlessness coming in, and that increases the state of stress. Similarly, you have coronavirus depression. All of us know that depression is something that is a mental disease. But here we are talking about coronavirus depression in terms of the quarantining depression. Guys, I am telling you, I am one person who gets up at 5 o'clock in the morning. I have my lectures start by 7 in the morning, and I work right till 7 o'clock in the evening. And when I was diagnosed with corona, and the first thing the doctor told me is that you need to quarantine in your room for 7 days, and you can't come out of the room. Just have some family member give you the food and whatever whatever. I went into a straight form of quarantining depression, because 100 thoughts: who's going to get the vegetable, who's going to give instructions to the maid आएगी कि नहीं, who's going to feed my son, I mean I have a young son, is he going to get enrolled, I mean उसके classes bunk कर लेगा क्या, वो mobile पे क्या देख रहा है, is he going to be watching the right thing, मेरे को खाना time पे क्या देख. 100 thoughts came into my head, and my body was not allowing me to get up. My body was tired, my throat was terrible, but these thoughts were running into my head, and I had a severe bout of crying, feeling low, okay, not being able to concentrate in what I'm doing. I know my husband was telling me that I was doing a lot of sleep talking also, feeling of helplessness, that why me, I did all the protection stuff, मैं तो mask पहन के ही घूम रही थी, etc. I was very angry on my husband because he had coronavirus just 10 days before me, and I was really angry on him. And then I was talking to my sister on the phone, and she told me कि दीदी उसका थोड़ी ना fault है, सबको हो रहा है, अगर आप 10 मास्क पहन के भी रहोगे तो भी हो सकता है, so why you getting angry on him? I'm like, no, because he gave me coronavirus and I can't get it, and this that. So basically this is your outburst when you are depressed. And depression and anxiety, like I said, to touch base again, are mental diseases which are basically involved with your mental well-being. So when you're not in your happy mental state, you do suffer from any of these or both of these. Now it's very interesting to share this with you. This is when you are this when we had got when corona virus struck us nearly 2 years back. Now we know that the first phase was when there were a lot of death and illnesses, family losses of close family members, because this was a pandemic that we didn't know how to deal with. And of course now we are dealing with it in a much better way. But right from 30% salary cut, people losing their job, not having access to healthcare services. How many of us in the first phase or second phase, I think you all guys must be 21, 22 year olds, so you've seen that your vaccinations have started. But I know during our time how many days we have spent on that Aragya Setu, just waiting to get an appointment. And it's just been a whole phase of a lot of challenges. Amidst this, a very strong issue came up, and that was the social stigma. So now we are in the third phase. Everybody is getting the virus or Omicron, and people are not so serious about it. And people say, "Oh my God, corona hua hai, acha rest le lo." But think about it, when it just came in, as soon as anybody got to know that another person has got corona, it became a kind of social stigma. People thought it as that you are a bad person or you've done something wrong, that you've got the infection, and people didn't know how to handle it. And this is a story that has come up in the newspaper of a 66-year-old guy, Mahesh Bhai. And of course this is just an article where his wife went into the hospital because she was suffering from corona symptoms. And the husband didn't know how to handle her news, did not know how to handle the fact that she's not there and she's under treatment, that he started developing suicidal thoughts. And the suicidal thoughts were so strong that he went and consumed poison to attempt suicide. Of course, he was diagnosed, and he was found to be having the psychiatric symptoms of simple thing like worry. He got so worried that his wife's health was not good, that he didn't know what was happening with her. He didn't know whether she's eating well or something, that he developed these symptoms of suicide. And he tried it out, and of course God forbid things went all right. But this is something that we've seen also. And guys, I can completely relate with this. Like, I'm giving you my own self disclosure, I don't have suicidal thoughts, but even being so knowledgeable about what is corona and how to deal with it, my fear was only one major thing. I have a son who's only 12 years old. I'm diabetic. I don't want to be in the ICU. I have read so many stories of diabetics and comorbidity people being in ICU, being on a ventilator, and I was like, oh my God, will my lung collapse? Will my breathing happen properly? Do I need to be put on some kind of oximeter? What is going to happen? So I don't want to get corona. And then I got it, and it's not that bad, of course, but it's not good either. So this is how your mind stays disturbed, and when your mind stays disturbed, you can't have a strong mental well-being. So this is all the negative side of everything. Guys, everyone's with me?
Yes, ma'am.
Okay. So how does one cope with this COVID? So I'm sure all of us have read, and we do a lot of reading, and I'm sure many of you know better ways than I would suggest. Number one, we've heard of the word smartphones, and there's no harm. Most of us have spent a lot of time on the smartphone, and we've been given different series of advices on it. Too much is not good, too little not good. Should we be on smartphone or not? And this is where I remember being in a session where there was a psychologist who was talking about that today adults still have a lot of things to do to keep themselves away from a smartphone. So you can see a lady, she'll go in the kitchen, you'll have a man who'll probably make multiple office calls or be involved with office numbers, etc. But what does a child do? A child needs the space to go out and play. The child needs friends. The child needs to go to school. The child needs to go for his painting class or his ballet class, and everything is stopped. So how much is he going to do at home? So obviously he's going to divert into his world of mobiles and internet and smartphones. So it's very wrong to take away the mobile from a child, during, I'm talking specifically during COVID, and say nay, too much of mobile is not good. Okay, because the child will not have any other tool to reach out to. So we have, I'm just going to quickly give you certain apps that have been developed, um, um, you know these apps can help you to deal with mental health online. Before we go into it, this is just again a very quick data that was collected in India, and it was seen over few months, that around 2000 young people have answered to this survey, and it has seen that the bit worse is 50% of mark, which is showed that these are people who have mental health needs. Okay, they need to reach out to professionals because they have had their mental health affected for whatever reason, be it anxiety, depression, etc. So look at these apps. Just to name some of these apps are there online. It's called a balance app, it's called a headspace app. Now these apps are basically your personal meditation coach. So they will teach you how to stay calm, they will teach you how to reach your goals, they will help you to deal with problems which are related to anxiety, sleeplessness. Now this is also something that has happened, guys. Like I'm telling you this, today morning today afternoon I had this talk. Yesterday till 4 o'clock I was awake. Okay, now my husband asked me that why aren't you sleeping, you're tensed because of the talk. So I said, तुमको क्या लगता है? So he's like, नहीं, तुमने इतना talk किया है, तुम talk के वजह से nervous नहीं हो तो तुम सो क्यों नहीं रहे हो? I said, because I have already slept for more than 12 hours during the day during the medicine, and now when I'm trying to sleep in the night, I have so many anxious thoughts that are running my head, that I got a couple of blood tests done. Is the report all right? Is there any clotting in the lungs? I don't know, thoughts are just running in my mind. 4:15 I couldn't sleep. And when you don't sleep well, I'll be coming to it, of course you don't feel mentally healthy, and physically you feel down, and this all comes out in your behavior, where your relationship with people around you again become very strained because you're irritable, you shout, you scream, etc. So headspace app will kind of help you deal with this. Then there's another app called Sanvolo. Okay, this is again a very interesting app. You need to register here, and these apps are, they have, all these apps have customized videos and short movies and different content to develop skills to deal with calming yourself down, de-stressing yourself down, building your productivity. Another app called the Calm app. So moving on, this is just my picture. I'm sure all your parents are working, some of your parents are at home, and this word about stress during COVID is something that is become old now. It's overwhelming now to understand that what is stress, and how do you handle it. So when we're looking at dealing with this stress, and when we're dealing with this social isolation, social distancing, let's look at some healthy ways to deal with stress during this COVID. And the first important thing is that you need to rebalance work and home. This is very, very important. People from the corporate world will make you work because they are paying you salary. Finance and money and economics and GDP is a very, very, very big thing in the world here, especially in India. But guys, you know you need to know when to say stop, you need to know when to give yourself that time off, and you need to know how to avoid spending too much of time at work, and you need to get that space for yourself and me space. I'm saying even within COVID. So even if you can't go out, even if you are stuck at home, or even if you are going out and you can't meet people because of whatever the government rules and policies are, you still need to rebalance your work and space, where you can't just say ठीक है friends नहीं है कुछ है नहीं तो मैं काम ही कर लेता हूँ. ठीक है, that's not right. You need to rework that. Regular exercising is very important. We all know this as adults. I'm sure 100% of y'all are fitter than me, but I have realized this. Sometimes they say that when you are struck with something really bad, certain strong realizations happen, and I've just realized this, that it's very important to keep yourself moving. It's very important to let your nervous system increase the blood circulation, and all your organs play their role. So whatever form of exercise makes you happy, 20-25 minutes on a regular basis, etc., is good. So guys, like I said that I am nearly going to be 50 years old, and I moved from Calcutta to Bombay when I was 18. And I think from 18 to 50 years old, I'm 49, 18 to assume 50 years old, these 32 years I have been absolutely a workaholic. I really work hard, and every time these lockdowns have come in, and every time our movement has stopped, I cannot tell you. First, 2nd Jan, my husband was diagnosed with COVID, and today is the 16th Jan, and 14 days, which is 2 weeks, we have not stepped out of the house. And I am feeling sick, I'm frustrated more than my physical thing. I want to go out, I want to stand in the middle of the road, I want to go to Juhu beach. I stay in Juhu in Bombay. I am so frustrated because I'm not able to go out of the house. And I know that if I step out of the lift, the watchman knows that I've got COVID, because here BMC has informed everyone. But it just makes me feel terrible that I'm not able to go out. Okay, so it's important that you need in this state to connect with people. Okay, and connect by people, because when you talk, when you meet people face to face, when you laugh loudly, you will release happy hormones. I don't know how many of you laugh loudly, but I just feel that one should just laugh really loudly. You should just start doing silly things. When people turn around and say she's mad, she's silly, or he's silly, just look at the way he's laughing loudly. It just releases those happy hormones, because people turn around, look at you, and that's the way you've connected. And of course, when you're with your friends and you connect, that's really nice. Make hobby time during the day, and make that a priority. So as much as you work, whatever is your family life, you must have some creative pursuit for yourself, some creative hobby for yourself that gives you joy. And this is the most important thing. And I love this. There are people who are toxic in your life. They will make you feel more angry, they will make you feel more overwhelmed, and they will make sure that you feel low self-esteem. So just before the talk today, I have a best friend from Calcutta. She is a widow, and she became widow with a twin when the twins were born. And couple of years later, I think they were 3 years old, and she lost her husband to cancer. And friend of mine is same age as mine, 50. We've been in school together, and just she called and she said, "Hi Meghna, how's everything?" And I was like, "Okay." And then she said, "I have bad news." And I was like, "What?" So she says, "I just got my thyroid tested, and they found that they are malignant, and there's cancer. So I need to take care of it." She lost her husband. They used to live in London. She lost her husband in cancer, and now she has, of course, she has twins, the boy and girl. And when she said that, her name is Shreya. I didn't know how to react. I was like, "What are you saying, Shreya? I mean, how?" So she says, so for 2 minutes there was silence. And guys, this is really overwhelming. Okay, this is really sad. And she said, and then she says, "But it's at a very, very beginning stage. It's something that can happen to anybody. So I'm glad that it happened, whatever." Then I just asked her, "Are you scared?" So she says, "No, I'm overwhelmed. I mean, but I have to deal with it." And So I asked her, how many people did you tell? Because we have a group. So she says, nobody. I'm just telling you, and I have told one more friend. So I said, why not the others? So she says, she said one very interesting line. And I'm really telling you this, guys, sharing this with you just around 45 minutes before the talk. She says, Meghna, I need positivity. Okay, I need positive people around me. I need people not to make me feel that, oh my god, what if you die, your kids are so young, what will happen, have you taken care of your will, I mean, is it going to hurt the surgery, are you going to do it in India, west, here, there, are you sick, are you bleeding, are you vomiting? I don't want people to do that. I just want people to hear me. I want people to be positive around me and give me that strength that, come on, Shreya, nothing is going to happen, everything will be all right. So I felt good that she's telling me that I'm positive, but I was like, thanks, yeah. So she says, नहीं, I'm just telling you because you also have thyroid, तो तू भी जाके check करवा ले तेरा. But whatever. So disconnect from toxic people. I have realized this, guys. I had so many toxic people in my life, and they've only pulled me down. And it's only when you ignore them that makes them more frustrated and just keeps your heart easier. So this is important even during COVID, and during COVID more so because a lot of people will give you a lot of bad vibes. Like, I have heard a lot of people, teachers, telling students, oh my god, you are such an unlucky batch, you're a COVID batch, कोई job नहीं देगा, because you all do online exams, सबको 100 out of 100 आ रहा है. But वो student का fault थोड़ी ना है कि उनको 100 out of 100 आ रहा है, ये students के fault थोड़ी ना है कि COVID आया है. And why should it be that you stigmatize a person saying you're a COVID batch of academics? Doesn't matter. Every day, guys, you all are from Delhi, you all are reading what UGC is saying, that give the students recognition even if they are COVID batch. Don't pull them down, generalizing and stereotyping that everybody who gets good marks is sitting at home and copying the exam. करते होंगे लोग, but don't stigmatize it. So develop a group of people who are very positive around you, people who live life full size, all is well. Have a good sleep schedule. When I did not have COVID, I used to sleep at 9 o'clock. I know the world laughs. A lot of people don't believe and they think that I'm ignoring call, but I go to sleep at 9 and I sleep like a baby till 5 o'clock. I don't care who has eaten dinner in the house. I don't care whether anybody has done what anybody is doing, but I take my healthy sleep from 9 to 5, and it's very strongly recommended that good amount of 7 to 8 hours of sleep, because otherwise it will absolutely create havoc in your mind. So this is a basic plan. Another very important plan, कोविड के टाइम पे, ओके, लॉकडाउन है, कोविड के टाइम पे थिंग्स आर नॉट working as per your regular schedule. There is uncertainty, but you don't alter your daily routine. And this I would like to tell all of you guys. I'm telling you, I have made sure for my son. कोविड है मतलब रात को 2-3 बजे तक जगना है, देन सडनली एट 2-3 o'clock से चलो मैगी खाते हैं, कल तो छुट्टी है, कोविड है, वी डोंट हैव टू गेट अप इन द मॉर्निंग. वन डे, वन टाइम, टू टाइम, थ्री टाइम, ओके. बट द टाइम यू ऑल्टर योर लाइफ रूटीन जस्ट बिकॉज it is a pandemic and things are different, you will see that your mental health will start suffering, because it is going to be that you're not going to be able to get back to that normal routine. You're going to have difficulty in getting into a normal routine. So don't do that. Go back to a normal healthy life. Get up and do your exercise wherever, whatever space is available. Get up and follow that routine. So I head the psychology department, and when I had COVID, when it was bad, I'm sure they must be the happiest in the world, because oh my god, ma'am is not going to take 7 o'clock lecture. And I didn't I sent a message to all of them, guys, I'm COVID positive. Along with me there were 4-5 of them, and I said, meet you tomorrow at 7 a.m. And immediately there were question marks that came in the WhatsApp group, are you still taking lecture? And I messaged them that no, but I'll make you all hear music. Or 7 o'clock, I put on that, I don't know how many of you know that Mithun Chakravarti ka D for dance, I for, do you know that song, that disco wala song? I put it on at 7 o'clock. So 2-3 of them said, ma'am, we are dying, can we keep our camera off? I said, नहीं, सब कैमरा ऑन रखेंगे. ज़्यादा से ज़्यादा क्या है, बाल कंघी नहीं किया है, खास जो तुम लोग चादर ओढ़ के सोए हो, doesn't matter, but don't break the routine. I know this might sound very insensitive, but once in a while okay, but don't get into this sick mode that COVID is there, sickness is there, so I need to be depressed. Now look at this picture over here, she's sitting there. Oh my god, life is such a loom. That doesn't work like that, okay? Because then you will have everything coming inside your head. So this is something that is important to see. This is again a very recent statistics which just shows that more and more adults are suffering under worry. And just see if it's a ratio of around, this is the data around 3 to 4 months, and you see how people are getting affected by the COVID this thing. And guys, this is something that we really need to worry about, okay? We really need to worry about how young adults matlab adolescent and the youth are getting upset, the way they behave, so much of frustration in them because of the different challenges of the thing. So like I said, these are certain self-care strategies, okay? Go to bed early, take care of your physical health, take care of your mind. It's important that there is some kind of movement. I have banned junk food in my house. My son put on, everyone was suffering from lack of B12 and D3, and business houses, medical pharmacy center, people have become crorepati because D3 B12 किसी का भी लेवल नॉर्मल नहीं है, बिकॉज हम धूप में जा ही नहीं रहे, हम घर से बाहर ही नहीं जा रहे. सो इट्स इम्पॉर्टेंट दैट यू अवॉइड, वी ऑल नो दैट junk food etc over a period of time, and deal with your sleep and physical activity. Now that's the physical care. Your mind, how do you take care of your mind? Like I said, maintain a routine, keep your schedules steady, get involved in certain new projects. अगर college बंद है, अगर I know that Delhi University is closed and y'all are not having online classes, sorry, you're not having offline classes. Bombay, in Mumbai, we had started college post Diwali, and guys, they said, this is really honest, huh? They said that we will do a parent consent form, and only the one whose parents sign, they can come to schools and colleges, the rest can do it at home. And guys, you will not believe, my son is 12 years old, he has 20 students in the class. The first day, all parents signed the consent form and said, please let the children go to school, okay? Because it's important that you get involved now, okay? We need to go back to our normal state, get involved in certain important projects, care for each other. This is important. How many of you have helped people, your neighbors, in whatever was allowed and how much ever you could do? It's important that you care for others, because that will make you feel good. And imagine what must have been the state. I cannot even imagine what would have been the state of my father, who lives in Calcutta all by himself, if maids never came. How much we could have connected with him on the phone. So it's very important that we help each other. Another thing which is very important is humor. How many of you think that humor is important? Humor. So you have your chats, you have so many different quotes, memes, uh, use all of them to create humor in your life. Reach out to people to give them the social support, whoever the elderly people are, and reach out to helpline. Now this is one thing, again I tell everyone, uh, any of you in the audience, if I ask you, can you give me a dentist phone number, I'm sure your family directory will have a telephone number. A general physician, you will have it. I don't know how many of your mobiles have a psychologist phone number. Now that you can take mine, okay? I don't charge for student counseling. I'm on your Miranda house counseling. So anytime anybody wants to call, any time of the day and night, you can call. I'm sure you all are aware of this, that you all have an excellent counseling service, and I'm on the panel, and there are many others also from Delhi and elsewhere. But it's very, very, very important, absolutely important. You have Amazon, you have Swiggy, you must have a psychologist phone number, a counselor who you can call online, a counselor who can give you information, a counselor who can listen to you, share information with you. This is very important when it comes to taking care of your mental health, because you may have hundreds of very good friends, but friends are not counselors. They will listen, they will advise. Counselors don't advise, but they are official channels and sources who can help you to deal with whatever anxiety or anxious thoughts that are going on in your mind. Another thing to keep your mind happy and healthy is, जो पढ़ते हो वो पढ़ो, बट उसको वेरीफाई करो. Don't just read that, I mean, you hear, oh my god, Bombay, 25,000 cases every day, people are dying, people are just falling on the road and they're just dying. This is bullshit. Okay, this is overload of information. This is gossip that is floating everywhere. So don't post such information, don't believe such information. Read the information, verify the information, and then react, rather than just reacting by reading information. And of course, like I said, avoid stigma and discrimination. Don't hurt people who are sufferers from COVID. Like today, I was talking to a friend of mine, and she told me that this third friend of mine has got COVID again. एंड आई से फेंक रहा होगा, कैसे हो सकता है, डबल वैक्सीनेटेड है, एक बार हो गया तो क्या एंटीबॉडीज डेवलप नहीं हुआ है. सो दैट फ्रेंड से नो, ही रियली हैज़ कोविड. आई सेड आई एम श्योर ही इज बुलशिटिंग, यू शुड जस्ट लैंड अप इन हिज हाउस. Now this was really wrong of me. This is of course a humor, casual talk, but don't stigmatize people, don't discriminate people. Allow people to take their medical care, allow people to reach out. And the last slide over here, I would say, this is important, guys. Okay, you can take this phone number down. This is a very, very well known helpline called iCall. It is a helpline started by Tata Institute around 10 years back. They use telephone, they give you telephonic, email, chat based counseling, extremely confidential, extremely professional, very, very good. I can vouch myself, I know who's the founder, I work very closely with her. And it works from morning 10 to 6, and these are the languages that they work in. Very, very, very strong helpline, because the telecallers are not Ila Baila. Each of them are trained masters in psychology. They are doing it because they want to help out, and they are trained professionals. So within the first 10 to 15 minutes, I can guarantee you this, anybody can tap back at me if I'm wrong, but they will take you out of the problem that you are feeling. And of course there's a follow-up, etc., and they're very confidential, so they're not going to land up at your house, etc., but they're very professional. So you can take this phone number down. This is a COVID-19 helpline number, and of course post-COVID, pre-COVID, it's still called helpline, and they do a lot of psychological, social counseling. Especially during COVID, a lot of people have had a lot of social adjustable issues. Hostels have closed down. Bombay has a whole rental scenario. People have given other people tough time. So maids have had no job. People have lost out income. So it gives you a socio-psycho counseling. Plus, of course, it's another thing. So with this, I would like to end here, and I can take up the questions. Just give me a minute.
First of all, ma'am, we'd like to thank you so much for these kind and insightful words. And I definitely say that you've beautifully depicted the situation that we're in, like the contradictory times that we're living in, where there's so much uncertainty, and yet at the same time you have to follow this monotonous schedule. You have this explosion of information of what COVID is, but you have no idea how to deal with it. So these times have definitely been difficult for all of us. And your candid conversation that we've had has been quite cathartic, especially for me, and I'm sure for every other participant. That knowing that what you're feeling is normal, it's natural reaction to these. I mean, I don't want to use it, but these unprecedented times that we're living in, and that also the knowledge that you can go out and you can get help and you can feel better. And we're deeply grateful for all the resources that you've provided us. Now, I hereupon call Ms. Sheetal to carry on the event.
Thank you, Samriddhi.
Thank you, Samriti. Good afternoon, ma'am. This is Sheetal, and I will be asking the most frequently asked questions which we have received after circulating a Google form. And the first question is, everything has shifted online, and we are stuck in the loop of monotonous life. Ma'am, how would you suggest us to get out of this monotonous life that we are living every day with exactly a repetitive schedule?
Okay, so like I said, guys, that India is all about schedules, right? We have been taught schedules right from the day we were 2 years old, right? You see, today a 2-year-old going to school, okay? They will be also carrying one small, nice, fairy bag behind them, okay? Which will have a small tiffin box and a bottle. That poor kid, okay, is just about managing to walk, but follow schedule. And why schedule? Because the maid or the mother will stand in the bus stop because the child has to go to school by bus. Then the child will get down in the school and will the maid will take the child inside. Then there's a Gayatri mantra in the morning and there's a schedule, right? And then of course there's learning, which may be fun, but then there's again schedule that there's different times. Healthy खाओ, protein खाओ, paneer खाओ वगैरह. So we are used to schedules, guys. Okay, so COVID doesn't say that let's not follow schedule. Yes, the schedule now has moved from offline to online, and very badly said, but we are on our buttocks the whole day. Imagine sitting from 7 o'clock to 7 o'clock in the evening, which is like 12 hours, with those little bit of movement in the middle. But that's a schedule. That is something that you don't have a way out. So psychology always says, learn to be adaptable. This is the demand of the time. Tell yourself that iska ek end aayega. Okay, it's not ever ended. It's not that you are stuck on the chair for the next 15 years. It is a period that this is the best way out. Always remember that question, what if it was different? So what if Ayushi and Sheetal went to college in Delhi University and colleges have opened and everybody is breathing each other's back? Imagine you come home with the virus. Which is better? Sitting in front of a screen in your safe space, following a schedule, or being down with COVID where 4-5 days you're really bad because the throat is bad? So this is a better option. So always talk to yourself, cognitively rationalize and say इससे बेहतर क्या हो सकता था और इससे खराब क्या हो सकता है, right? So today I am a teacher. Like I said, मैं 7 बजे उठ के I am in a college. In 23 years of my life, I have not been late to work even one day. I'm really telling you. And today, even though I am at home, 7 o'clock lecture starts at 7 o'clock, and believe me, come to my house, my maid of course comes morning, but वो सब खाना वाना बन गया. और ये नहीं है कि मैं कैमरा बंद करके ऑमलेट बना रही हूँ. I am morning, I am bathed, I am in my, of course ऊपर में भी सलवार कमीज, नीचे में भी नाइटी और शॉर्ट्स, but I am following a schedule. And because I follow a schedule, my students follow a schedule, and because they follow a schedule, कल इंटरव्यू अगर कोई बोलेगा 9 बजे, तो तुम 8:45 आँख रगड़ते रगड़ते नहीं बैठोगे, तुम टाइम से बैठो. So guys, I know it is not as advice or preaching, but I know this is difficult. I know that you don't feel like wearing a kajal. Today I'm wearing kajal and lipstick after such a long time, and my son was laughing and he's telling me, the COVID patient is wearing lipstick in front of the screen. Because अभी हम लिपस्टिक यूज़ ही नहीं करते ना, कि ज़रूरत ही नहीं पड़ती है, राइट? यस, कितने सलवार कमीज वैसे ही इस्त्री पड़े हुए हैं, बिकॉज वी डोंट गो आउट, राइट? Kajal pencil, generally what we buy now is all lying there, because we don't need to wear kajal in the house. But we are still doing our work because you are still contributing. आज अगर मैं contribute करना बंद कर दूंगी, I don't take my classes, a lot of people will get affected. So students, look for fun in your schedule. Like I said, 7 o'clock when I entered the lab, everybody used to sit and say, Meghna ma'am aa gayi, abhi PPT on hoga. Now I put on the weirdest of songs in the morning. Okay, believe me guys, you will laugh, but I put on, Nach Meri Rani, and students are like, oh my god, ye danger aa gayi, and suddenly loudly there's Nach Meri Rani, disco, D for disco, this kind of thing, just to break the monotony. And suddenly in the middle of the lectures I ask questions to check whether students are listening, or camera band kiya to ... right? But I just hope I've answered the question. Bring humor, laugh, tell your teachers no कि मैम थोड़ा गाना वाना on कर दो, break the monotony, give examples. I didn't know that this Salman Khan was bitten by snake, so I asked in the middle of one lecture, एकदम भरपूर lecture चल रहा था, I asked one students that ये सलमान खान को सांप कैसे काट लिया, वो बॉम्बे में सांप कहाँ घूमता रहता है? तो बोलता है मैम वो पागल है, वो जाके पनवेल में बैठा है. आई सेड सी, और क्या कॉन्वर्सेशन, एवरीवन गॉट अप टू से किसका घर पनवेल में है, सांप उसको कैसे काट दिया, कौन सा डॉक्टर के पास वो गया. 5 minutes of distraction. So this is the way you keep yourself going. If you try to run away from problems will come running to you. Yeah, so deal with the problem with a rational mind, deal with it as it is here and there. You don't have an option, you have a mobile, you have a laptop, make the most of it, things will get better. Yeah, okay, yes, I do see the request. Can I see some more faces? It will be nice to see some questions and some more faces.
Yes, ma'am. Thank you, ma'am. And schedule are a part of our lives and we have to follow them. So we have our next question, that is, how would you guide us to bring back the motivation to study, to focus and concentrate? And I think ये सबसे ज़्यादा पूछा जाने वाला क्वेश्चन है.
राइट, सो थैंक यू शीतल. सी, मैं हमेशा अपने बेटे को बोलती हूँ 3 टाइप के लोग होते हैं, ठीक है? एक अंबानी के फैमिली का, राइट? तो इफ़ यू गाइज बिलोंग टू एनी अंबानी और मित्तल्स और जिंदल्स और समथिंग, देन यू डोंट हैव टू वरी. कोई मोटिवेशन की ज़रूरत ही नहीं है, बिकॉज पापा मम्मा चाचा ताऊजी उन्होंने मोटिवेट करके सब बना के रख दिया है. ओके, सेकेंड ग्रुप ऑफ पीपल, अरे भोर भड़कम लक, इतने लकी है लोग कि जिसमें उन्होंने उंगली डाला वो मिल जाता है, राइट? तो वी रीड ना, ये एंटरप्रेन्योर 10 रुपया से आया था, आज 300 करोड़ का बिजनेस बना के बैठ गया, ये करता था. दोज आर लकी पीपल, वेरी गुड. 2, 3, वेयर आई कम फ्रॉम, हार्ड वर्क. Only way to survive in the world is to be motivated and work hard, because it's only when you work hard and you put in effort, it will equal to performance, right? So you guys, I am sure, have an aim to go abroad and study, or stay in India and take further studies. Wherever, higher education is the mantra for success, right? Of course we have heard stories of people. Just today morning I was reading, abhi Elon Musk is a student of Wharton Business School, and he says that a lot of people who are doing very very well have never done MBA, because MBA has now got over. Do you know what is the latest course now? अब MBA नहीं चलता है, अब E-स्कूल चलता है. B schools खत्म हो गए, E-schools चलते हैं. What is E-schools?
I think it would be sorry, go ahead.
Yeah, what is E-schools, guys? Entrepreneurship school. You don't need to do MBA, you don't need to have a degree, you just need to be hardworking. So you need to be motivated that अगर ज़िंदगी में कुछ चाहिए then you have to motivate yourself with your goal in mind, guys. Everything has a time frame. Everything. I mean, just you, I don't know. Is this thought scary to y'all that today, if it is right now, the time is 2:11, 16th January. This 2:11, 16th January will never come back again once the clock becomes 2:12, right? So this is the most of it. Like I told you, I was talking to, I think, I don't know which girl was coordinating with me for this talk. I told her that I don't want to do it on Sunday, can we do it during the week? And she just wrote one line, guys. Billy, and I'm telling you this also honestly, she says, ma'am, let me check if it is possible. And you know what what thought ran my mind? He opportunity only knocks once. Knock knock. और वो अपॉर्चुनिटी का दरवाज़ा अगर तुमने नहीं खोला तो 10 और जन है ना जो दरवाज़ा खोल देगा, राइट? सो डू यू अंडरस्टैंड? आई इमीडिएटली आई टोल्ड हर, नो नो नो, आई विल डू इट. And then my husband saying, you are 50-year-old, you are not a newcomer in the market. ठीक है? I said नहीं, but it's an opportunity. Sunday ही तो है, तुम लोग 2 घंटा सो लो आराम से कि वो चुड़ैल टॉक कर रही है. तो I know what my son is doing. He's watching some lovely Netflix movie. My husband's had his best 2 hours of sleep because wife is busy. 2 घंटे के बाद. But then do you guys understand that if I manage to share something with you, it's my motivation. So Sheetal, what I only have to tell everyone is, guys, opportunity knocks once. I know it's online, but take the most of it. This is the best time that you can work on your hair scheme. I mean, every day I see, you know, when you're at home, you can do the best for your body and mind. So stay motivated. Yes. Next question.
Thank you, ma'am. Yes, ma'am, you're right. And we have our next question, that is, we expected our college life to teach us a lot and shape ourselves to improve our personalities, but in this way it's really difficult. Ma'am, how would you suggest us to achieve this?
Okay, this is a very interesting question. Yes, of course, you know, institutions play a very important role in shaping your, you know, your personality, your social skills. And, you know, when that part is not there, there is a void. Okay, but like I said, again, I'm coming to the same point, guys. There is no point in life in crying over spilled milk. दूध एक बार जब गिर जाता है ना, उसको आप बर्तन पे इतना ही उतार सकते हो. एंड देयर इज नो पॉइंट इन क्राइंग. यू विल हैव टू मेक द मोस्ट आउट ऑफ इट. सो राइट नाउ द मोस्ट ऑफ इट इज, you know, ask your teachers. I'm sure everyone does it a lot already, you all are doing it, but get involved in activities where the other aspects of personality gets groomed and groomed. Now I'll tell you simple, like for example, today this talk has been done. I'm assuming it has been arranged by the vice president, moderator, president, some students. I don't see teachers doing this. I see students who have put the program together. Now this is excellent personality development, skill training, because right from getting in touch with me, getting my details, arranging the talk, making the poster, everything is skill development, right guys? Sheetal, right? Yes, यहाँ पे जिंदगी में checklist नहीं होता है. So this is what I'm saying. Make the most of what is there. Think about it that today if you guys have to give yourself certificate, Ayushi, Samriddhi, Sheetal, and I'm sure there are many more, you are not going to get a certificate for participation. You are going to take a certificate for organizing. And doesn't organizing skill mean that you have developed a personality trait? कल tomorrow you can even arrange that you can organize. ये कौन है तुम्हारी वो नंदा की बेटी, वो ग्रैंड डॉटर, अमिताभ की ग्रैंड डॉटर का नाम क्या है? श्वेता नंदा तो उसकी बेटी है, वो जो दूसरी वाली नवेली, नव्या. सी एवरीवन's woken up. नव्या नवेली का बर्थडे पार्टी. ओके, मैथ्स डिपार्टमेंट ऑर्गेनाइज इट, बिकॉज यू आर सो गुड. एकेडमिक का कर सकते हो तो ऐसे बर्थडे पार्टीज को तो आराम से हम कर सकते हैं. सो दैट इज डेवलपिंग पर्सनैलिटी स्किल्स, राइट? एंड दिस हु हैज गिवन यू, योर मैथ्स डिपार्टमेंट हैज गिवन यू द प्लेटफॉर्म, राइट गाइज? आई विल टेल यू अ वेरी अनदर गुड इंटरेस्टिंग थिंग. ट्राई एंड चैलेंज योर सेल्फ. तुम्हारे दिल्ली यूनिवर्सिटी में तुम लोग स्टूडेंट्स आके एक शॉर्ट 40 मिनट गेम सेशन करो स्पेशल चिल्ड्रन लोग के साथ. स्पेशल चिल्ड्रेन मतलब ऑटिस्टिक, डाउन सिंड्रोम, जो फिजिकल सेरिब्रल पॉलिसी वाले बच्चे होते हैं, जो व्हील चेयर माने होते हैं, उनके साथ एक ऑनलाइन करो. You will see it is one of the most challenging personality development thing because they are very difficult to handle online. But you will see the excitement and do simple things. उनको एक पिज्ज़ा दिखाओ और पूछो उनको कि what food is this, and you'll see 20 of them will answer at the time pizza. Show Salman Khan dancing and show Katrina Kaif and say ये कौन है, papa mama, and you'll see the kind of fun they have. Sheetal, that's a way of developing personality skills, right? So personality skills, of course colleges play a role, but since it is not possible right now in a physical form, these small ways can help you to develop. Yeah, okay.
Yes, ma'am. Thank you so much. Yes, ma'am. Moving ahead to our next question. How to bear the pressure of not having any social interaction, and some people might not have someone they can talk to and share their feelings. So, ma'am, what to do in that situation?
Fall in love. ये है ना, कितने सारे लवली एप्स हैं ना जहाँ पे यू कैन फॉल इन शॉर्ट टर्म लव. Like, please, I know this is being recorded, I need it to be heated, I know this is being recorded, but like you said that love is the best solution. Okay, so I don't know what, I'm married and I don't have time right now, but I would also get on to it. But that Tinder or what is it, Blumber, what is it, I don't know what is it called, Tinder only, no, something like that, Bumblebee or
Bumble.
something. Bumble, see there, see, yes, put a nice photo of yourself, put ulta pulta details, don't give all your details, and romance. Okay, just make friends online. Okay, start pen pal. No, तुम लोग के ज़माने में पेन पैल सिस्टम है नहीं. पेन पैल हमारे टाइम पे होता था. People around the world write letters, tell them what is good about your community, society, country, be there, have online friends. Of course, be very very careful about the cyber issues. I am not propagating wrong things, but I'm just saying, again it's in your hand, Sheetal, it's again in your hand. जितने फ्रेंड्स को तुमने इतने सालों से कांटेक्ट नहीं किया है, टैप करो उनको, एक जूम सेशन करो. जस्ट इमेजिन आई एम 49 and today when I went to a zoom session with my school friends, all that we were saying, oh my god, you have a son, you have a daughter, and then I got to know so many of them are in Bombay themselves, and this and that, एक के बाद दूसरा हुआ, तीसरा हुआ, then we got bored. फिर again people said come on, let's do it. So make small efforts, take small steps to connect. It's not difficult. एंड अगर नहीं हो रहा है, अगर तुम फिर भी सोशल आइसोलेशन में हो, आई एम टेलिंग यू, बेस्ट गो ऑन द टिंडर, ब्लम्बर और बम्बलबी और वॉट एवर एंड जस्ट मेक 1-2 बॉयफ्रेंड्स. Just tell them that I want to chat, I just want to talk, let's talk college. Okay, next.
Thank you, ma'am. Ma'am, I have a personal question related to that. When we, as you said, कि पुराने friends को ढूंढो and chat with them, but there comes a thing कि ignorance. Ma'am, I think most of us are dealing with that, कि हम लोग message करते हैं and we don't get that satisfactory answer. So in this case we have another form of stress कि हमें ignorance देखना पड़ रहा है, we are not getting what we want, how we are responding to them, we aren't getting that response. So how can we deal with that situation?
Okay, so I'll show you one action, maybe you'll understand, Sheetal. What is this? Can you see? I'm doing something. Okay, what is it I just did? ये तुम्हारे ज़माने के सब बच्चे लोग आखा दिन सेल्फी सेल्फी सेल्फी, फिर वो सेल्फी तुम लोग फेसबुक में डाल देते हो और पूरा टाइम कितने जन ने लाइक देखा, कितने जन ने आई लव यू लिखा, कितने जन ने उसमें तो हार्ट और बबल और क्या GIF डाल दिया, और जितना ज़्यादा उतना ज़्यादा खुश. आज आदित्य ठाकरे जी ने भी डाला है, आई हैव 10,000 फॉलोअर्स. अरे चलता है दुनिया में. आज अगर शीतल तुमने किसी को लिखा, व्हाट आर यू डूइंग, आई एम बोर्ड, लेट्स टॉक, ओके और उसने जवाब नहीं दिया, कोई बात नहीं, बी लाइक माई सन. वन गर्ल कॉल्स हिम एंड सेज, रियान, he'll say, yeah, are you free, what happened? No, I just want to know that do you have the English notes? No. No, do you have? No. Anything else? Tuck. तो आई कीप टेलिंग हिम, तो ऐसे क्यों बात करते हैं? मे बी दैट गर्ल हैज़ अ क्रश ऑन यू, तो थोड़ा एक दो और सेंटेंस बात करो ना. तो इस मम्मा आज उसको ज़्यादा 3-4 बात और सेंटेंस कर दिया, कल 2-3 और लड़की लोग फ़ोन कर देंगे. अभी मेरे पास टाइम नहीं है लड़की लोग के लिए, हैरी पॉटर का मेरे को बहुत कुछ. ही इज़ जस्ट सो बिंदास. कोई बर्थडे में बुलाया तो बुलाया, नहीं बुलाया तो उसको गिफ्ट नहीं मिला. कोई उसको फ़ोन किया, he does not want to get romantically involved, he doesn't want to get involved beyond anything besides Harry Potter. So आज के young लोग को मैं क्या बोल रही हूँ guys, reach out, put in effort, but अगर वो satisfactory revert नहीं आता है सामने से, let it go. Yes, it is better to have 1 or 2 people who are qualitatively there with you rather than collect a bag full who are not there, but just you're collecting them for the sake to be there. Don't become page 3, don't become socialites, just become good friends. Yes, there is, you know, जवाब दिया, अच्छा लगा तो ठीक है, कॉन्वर्सेशन करो. नहीं कोई सामने वाला कॉन्वर्सेशन एक्सटेंड कर रहा है, प्लीज़ रिमेंबर इट डज नॉट रिफ्लेक्ट एनीथिंग ऑन यू. एक बार ऐसे भी तो सोचो कि उनके लाइफ में भी बहुत कुछ होता होगा that the person may not be wanting to get involved in conversation. Do you understand what I'm saying? Like I told you, my friend Shreya, today she called. I had a half an hour conversation with her, but I don't want to call her again in the evening, again call her tomorrow morning, because then she will feel कि मेरे को sympathy दिखा रही है. Right now she doesn't require sympathy, she's not dying. I just told her one thing, that Shreya, if you want me to run your reports in Bombay, just send me your reports and I'll take a second consultation. अगर किसी डॉक्टर को दिखाना तो मेरे को बता देना. I have genuinely meant what I want to give her. If she wants to take the help, she will reach out. If she doesn't, that doesn't make me a bad friend. Got it, Sheetal? So if you send a nice salwar kameez picture to a friend and she says nice, ठीक है, nice, अरे उसने ज़्यादा क्यों नहीं बोला, पिंक सूट्स यू, ये डजेंट मैटर. Elaborations can be fun. Elaboration does not mean that you are not good enough. So never, बोलते हैं ना, fish for compliments. If it comes your way, you're lucky. Doesn't come, doesn't matter. I know many of you may think that मैम you're old, you're giving very practical. ऐसा होता नहीं है, हमें ज़रूरत है. मैं थोड़ी अलग टाइप की हूँ, मैं वो सब लाइक वाइक के ऊपर जाती नहीं हूँ. लोग ने बोला तो बोला, नहीं बोला तो आगे हेड़ो. I don't collect people, but I know young people like that. It's okay, it's normal, but if you're not getting it, दिल पे मत लो. चलो next question darling.
Thank you, ma'am. Yes, ma'am, we have a next question, and that is, how can we reduce our screen time, as we need to do a lot of work online, but still it has a lot of impact on our physical health, and eventually which leads to have an impact on our mental well-being. So how can we reduce?
But screen time is the mantra for working now, no? Everything is on screen time. So how can you reduce it, no? Guys, so depending on what is the requirement. See, I start my screen in the morning at 7 o'clock, and I have to do screen time till 7 o'clock in the evening, and that is a requirement for my job, right, to do screen time. And after that I have to do little bit of Anupama, I have to do little bit of Netflix. I like to see that इमली, बिकॉज मेरे को भी फोमो है, मैं भूल जाती हूँ, मैं 3-4 दिन बाद देख लेती हूँ इमली ने क्या किया, अनुपमा, दी सीरीज. तभी अनुपमा किसको चाटा मारेगी, उसका कौन सा स्पीच होगा, इमली कौन से जंगल में जाके खो जाएगी, मुझे भी वो फैंटेसाइज करने के लिए चाहिए. तो आई डू स्क्रीन टाइम, आई डू प्रॉपरली 10-12 आवर्स ऑफ गुड स्क्रीन टाइम, एंड इट्स अ रिक्वायरमेंट. एंड ऑफकोर्स मेरे चश्मे का नंबर बढ़ गया है, मेरा पेट तो मतलब महाराष्ट्र से पूरा दिल्ली होके नागपुर भी फैल गया है, बट what can you do? As a teacher, I can't jog in the class, no, when I'm taking the lecture. I have to sit and take the class. So screen time, जो requirement है वो करो. Of course, breaks low, because your eyes needs break, your mind needs break. So take those breaks, but what is required is required.
Yes, ma'am. Moving ahead to our next question. COVID has devastatingly condensed life loss. Many of our close ones have lost someone. Ma'am, how to deal with this mental trauma and negativity?
Yeah, this is very important, and this is a whole separate workshop, Sheetal. It's called grief counseling. Okay, because it's a very complicated question. I'm touch wood, I have really not lost for COVID, but I lost my father just before COVID, and it's a very difficult process to grieve. It's not easy to say it in a one line sentence, because this is a loss that is very difficult to understand. And COVID के time पे तो the loss का whole system has been different, क्योंकि you have not received the body, you have probably not been able to talk to the person last few days, because एक बार वो हॉस्पिटल में चले जाते हैं, फिर यू डोंट गेट टू मीट फ़ोन पे जो थोड़ा बहुत बात होता है. सो इट्स अ होल डिफरेंट सिनेरियो ऑफ डेथ, एंड bereavement, बोलते हैं ना, ग्रीफ एंड bereavement. तो यू नीड टू रीच आउट फॉर प्रोफेशनल हेल्प. ओके, बिकॉज ये खुद से नहीं होता है. पीपल हु हैव लॉस्ट family members who are close to them, at times it is important to reach out to professional help and learn how to deal and grieve and bereave. ये overnight नहीं हो सकता है, ये time लगेगा. You have to train yourself to get used to the person not being there. Again, the first definition of mental health मैंने बोला, you need to get into normal emotional adjustments. You cannot become an emotionally neurotic person. Do you understand? मतलब जिंदगी एक और रूल याद रखो हमेशा. My dad used to always tell me this. Okay, Sheetal, so I'm answering the whole class. Nobody is indispensable in the world. What does it mean? दुनिया चलती जाएगी, लोग है या नहीं है. हम जितना भी लॉस बिरीवमेंट फील करें, हम 2 दिन 4 दिन 6 दिन 10 दिन बाल कंघी नहीं करेंगे, खाना नहीं खाएंगे, बट दुनिया नहीं रुकेगी. राइट? एंड आप देखो, आप किसी का भी देख लो, कोविड और नॉट कोविड, आफ्टर 8-9 days you will have to eat food. After 12-13 days you will have to take a bath. And 15-16-17 day के बाद you will feel like eating pizza also. And that does not make your loss less. There's no need to feel guilty for not feeling sad, because life has to go on, right? So कोई किसी के लिए indispensable नहीं होता है. So grief, bereavement, for loss of family members, close members, whether it's a pet, whatever, is a different process. You need to be in the process, you have to accept the reality, you have to go on with your life, etc. And of course take professional help if the matter is not in your control. Any other question, Lali?
Yes, ma'am. Thank you, ma'am. This will surely help them. Yes, ma'am. We have our next question. That is, sometimes the stress doesn't come from outside sources, but we develop it within. This COVID has harshly impacted our professional lives and is still doing so, which led to the stress about career. This somehow demotivates us and our energy keeps on wasting. So, ma'am, how can we cope up with that situation?
So your question is that you all are a little confused and worried about your career and where you all will get into, etc. Right? The thing is that. Okay. Now I'm assuming that you all are all second year college students, right? Second year college.
All the years, first, second, and third.
First, second, and third. Okay. So guys, like what I told my students were, uh, Career is in your hand. That is what I told you, that if you let COVID take you down, and if you stigmatize yourself and say I am COVID batch, oh my god, then you will become oh my god. ठीक है? So सबसे पहले टेक द बेस्ट आउट ऑफ वॉट इज देयर. हर चीज जिंदगी में जो होता है ना, उसमें से अच्छा ही निकालो. सो आई गिव यू द फर्स्ट क्वेश्चन. ऑल ऑफ यू ऑल आर सेविंग टाइम फ्रॉम ट्रैवलिंग टू कॉलेज. ट्रैवल टाइम सेव होता है. साथ में अलग अलग कोर्सेज करो. हाउ मेनी ऑफ यू हैव हर्ड ऑफ एडेक्स, कोर्सेरा, स्वयं? ऑल ऑफ यू हर्ड. Guys, trust me, I've done 73 Coursera in these 3 years. 73. And एक के बाद एक के बाद एक के बाद I do it because I find it interesting, because time है. I'm saving on my travel time. So if you do Coursera's, it will work somewhere. कहीं पे तो वो तुम्हारा तुक्का लगेगा. Those certificates that I have done this extra bit. 2. You are not traveling. You have time. You are comfortable at home. Get involved in certain online projects of community work. People need help, right? People need volunteers. You can give them a lot from home online by helping in small ways. So whether that is working with elderly patients, whether that is working with special children, whichever. Now I'll tell you what I have made all my students do. I make them do after college. I tell them 1 hour of community work. So what they do is they have selected their own population. अभी जैसे ओल्ड होम में 4 से 6 बजे तक उनका चाय का टाइम होता है, राइट? So what my students do is 2-3 of them get together. They find out some old Hindi movie songs. They put the songs together. Then they make a small quiz. ये then they body morph, like they put Rajendra Kapoor, I mean I don't know, Raj Kapoor and all साथ में join करके ये पूछते. So basically what are you doing? उनके 2 घंटे के टी टाइम में तुम उनको एंटरटेनमेंट दे रहे हो, बट दैट इज ऑल्सो हेल्पिंग आउट. ओके, इसमें आपको क्या रिटर्न में मिलता है? यू विल गेट अ लेटर फॉर कम्युनिटी वर्क. आज दुनिया में अगर आपने एक्स्ट्रा करिकुलर एक्टिविटीज किया है, करिकुलर के बाहर, यू हैव कंट्रीब्यूटेड समथिंग टू सोसाइटी. आपका भी टाइम फ्रूटफुली यूज होता है. आपने करियर डेवलपमेंट के लिए भी कुछ न कुछ इंग्रेडिएंट डाला है, राइट? तो बिरयानी बनाना अगर हो और लाइफ का करियर बिरयानी है, और उसको तुम ऐसे तपेले में देख के बोलोगे बढ़िया बिरयानी बनेगा, बढ़िया बिरयानी बनेगा, बढ़िया बिरयानी नहीं बनेगा जब तक तुम उसमें इंग्रेडिएंट्स ठीक से नहीं डालोगे. और इंग्रेडिएंट्स वही है जो कोविड के टाइम पे भी है और जो नहीं है. यू हैव टू मेक द मोस्ट आउट ऑफ इट. सो डू कोर्सेज, एक्स्ट्रा कोर्सेज, डू कम्युनिटी वर्क. 3. How many of you all are involved in research work? Very important. Okay, छोटे छोटे टॉपिक्स लो. COVID and the impact of student mental health. COVID and something. ऑनलाइन डेटा कलेक्ट करो. गूगल फॉर्म है ना, आजकल तो गूगल फॉर्म का ज़माना है. आर यू हैप्पी और नॉट गूगल फॉर्म? डू यू वांट टू ईट समोसा और सैंडविच? गूगल फॉर्म, राइट? सो गूगल फॉर्म बनाओ, डेटा कलेक्ट करो. You are all maths and stats and everyone has basic percentage information. एक रिसर्च पेपर लिख के कोई भी न्यूज़पेपर में कोई भी एडिटर को बोलो कि हमने एक छोटा सा रिसर्च किया है, इट्स अ टॉपिक ऑन दिस. आई कैन गारंटी यू दिस गाइज, जर्नलिस्ट विल टेक अवे योर आर्टिकल्स और तुम्हारे नाम पे भी छाप देंगे थोड़ा बहुत मरोड़ के, बट दैट इज योर वर्क and that you have utilized online time to collect data, and few friends come together and do a paper. ज़्यादा data collect होगा. So do you agree that these are ingredients to build up your career? Guys, in last 2 years from my department, 13 students have gone to Canada and Chicago for masters in psychology, and they are all COVID batch. So they have applied, they have given their GRE, they have taken their TOEFL, all Canada, IELTS, all during these 3 years, and they have gone with scholarships and some have gone with paid program. Few more are planning to go to UK in the next 1 or 2 months, and these are students who have made the maximum staying at home. So career is sorted if you want to sort it out. Okay, next question.
Yes, ma'am. Lastly, I want to ask if are there any kind of activities to regularly check that we are not mentally ill, and are there any kind of exercises that we can do to improve our mental health?
Yeah, one, you must have a boyfriend और अ गर्लफ्रेंड, ओके, दैट्स वेरी इंपॉर्टेंट, दैट्स मेंटल हेल्थ चेकलिस्ट। हमारे एज में, हाँ, मेरे एज में नहीं, तुम लोग के एज में एक अच्छा फ्रेंड होना चाहिए, ठीक है। टू, तुम दिन में कितने बार लाफ करते हो ना। आई हैव ऑलरेडी सीन शीतल लाफिंग, आयुषी लाफिंग, आई डोंट सी अदर्स लाफिंग, बट इफ़ यू हैव गुड ह्यूमर, नो, जोर जोर से, अगर तुम्हारे नेबर ने तुम्हारे मॉम डैड को फ़ोन करके बोला कि कितना जोर जोर से हंसती है यार, देन दैट्स अ चेकलिस्ट। ह्यूमर इज, लोग गार्डन में जाके झूठ मूठ का लाफ्टर क्लब ज्वाइन करते हैं, और तुम्हारे एज में गाइस, आई एम टेलिंग यू, इफ आई पुट ऑन द कैमरा एंड टेल माई सन दैट लाफ, कोई तो कुछ तो फालतू जोक बोलेगा कि नॉक नॉक हु आर यू, नॉक नॉक हु आर यू, अरे नॉक नॉक ओपन द डोर, एंड ही स्टार्ट लाफिंग लाउडली, एंड आई टेल हिम यू आर मैड, कोई जोक तो सोच के जोक बोलना, बट ही जस्ट फाइंड्स लाफ्टर फन। And every day his teacher will tell him in the morning, believe me, गायत्री मंत्र शुरू करने के पहले कि रियान please crack a joke, and he will crack some stupid joke, you know, the donkey was walking, suddenly the dog turned around and said, are you a donkey, and the whole class starts laughing. And I have told him कि teacher will complain in parent teacher meeting that you talk nonsense, but the teachers have told me, man, he lightens the class, we feel nice when he makes us laugh. So शीतल, whoever's asked this question, it's a very interesting question, but जैसे ब्लड टेस्ट, शुगर टेस्ट, सबका टेस्ट होता है, मेंटल हेल्थ का ऐसे टेस्ट नहीं होता है। यू डू हैव ऑफ कोर्स हैप्पीनेस टेस्ट एंड ऑल, बट इन माई एक्सपीरियंस, आई थिंक अ पर्सन हु एक्सरसाइजेस anything, any form, a person who laughs, a person who has a lot of friends, lot means good friends, where you can have the conversation during the day, not during lectures of course, जब free हो, where you all can gossip, chat. ये gossip में जो मज़ा आता है ना, there's nothing like it. उसका हेयर स्टाइल देखा क्या तूने, क्या गंदा हेयर स्टाइल था, it's just fun, right? And of course, if you are in love, then there's nothing like that. That's the final wrapping paper. If you're not in love also, that's all right, okay, but these are simple ingredients guys, and do सोने के पहले हफ्ते में एक या दो बार do something good for society, return back to society. This is something that I very strongly believe in, whether that is giving some biscuit packet to some poor person. You know, I feel one thing very bad in the Indian youth today, and I see this a lot of times. आधा burger खा लिया, फिर you don't want to eat the other half, and you don't want to throw it to the in the dustbin. तो एक भिखारी आया रास्ते में, I'm talking Bombay, you give your half eaten burger to the kid. Not bad, okay, but in my opinion, I think it is going and buying the full burger and giving it, a better way of sharing rather than giving your half eaten thing. Okay, you don't have to give a burger, you know, I mean, many times, many times, this I believe very strongly, and I do this in my car. I always keep Parle-G biscuits, small 5 rupee biscuits. I have a lot of them, and you know, the 5 rupee Bisleri bottle, chota bottle. I really feel good that, you know, if I can give something in return to a person. You know, raste pe aap ja rahe ho, I don't know how safe it is in Delhi to do all this, but I'm just saying that somebody is standing on the bus stop for a very long time and it's daytime, it's safe, you know, you can ask the person, can I drop you somewhere ahead, you know, बारिश के टाइम में आपने किसी को हेल्प किया, यू नो, स्मॉल हेल्पिंग आउट थिंग्स, यू नो, अंदर से गाइस, आई एम टेलिंग यू, आई एम श्योर ऑल ऑफ अस डू इट, बट यू फील गुड। मेरे को तो बहुत मज़ा आता है, मैं तो ये भी सोचती हूँ कि आज मैंने कुछ अच्छा किया, कल शायद मेरे को कुछ अच्छा आएगा, मैं तो एक बार बोल भी देती हूँ, बट आई थिंक इट वर्क्स वेल, या। सो दीज आर स्मॉल सिंपल वेज ऑफ लिविंग लाइफ, एंड लिव लाइफ गाइस, एकदम बिंदास लिव, dance, watch movie. How many of you watched 83? How many of you watch Netflix? Just watch a lot of movies, have fun. Yeah.
Yes, ma'am. Thank you so much, ma'am.
Sheetal, I guess we can take the last question, which is by Shruti, I guess, in the chat box.
Ma'am, I'll just read out the question. I think it's ma'am, what is the difference between mood and emotion?
Okay, lovely. So, guys, if I ask you, just to the student who asked, if I ask you that, name me few moods. Give me names of few moods. Okay, supposing I ask you another question, give me names of few emotions.
Lonely.
Sorry? Huh?
Lonely. Does that count as an emotion?
Absolutely. So you will say happiness, lonely, sadness, jealousy, guilt, pride,
Yeah.
joy. There are 120
Sometimes
emotions, right? But mood is always just two, pleasant and unpleasant. You're either in a good mood or you're in a bad mood, right? Right? So it's either pleasant mood or unpleasant mood. So mood and emotions are different. It's not interchangeably used. Emotions require some cause behind it. So तुम बैठे बैठे हैप्पी नहीं होते हो. अगर तुम्हारे रिजल्ट्स आए हैं बहुत अच्छे मार्क्स से, यू आर हैप्पी. योर फ्रेंड हैज लॉस्ट her book and she is getting angry on you and she's shouting, you get angry. So there has to be a trigger behind any emotion. But I'm sure many of us have got up in the morning and said, आज मैं मूड में नहीं हूँ. And someone says, क्या हुआ, खराब ड्रीम देखा क्या? नहीं, I don't know, मैं बैड मूड में हूँ. And then you go in the morning and you're in a bad mood and friends say, क्या हुआ यार, get out of it the bad mood, क्या हुआ, मज़ा नहीं आ रहा यार, I'm नहीं मालूम क्या. So mood does not require a trigger. Guys, you all understand? Mood is a state of emotion where it is either pleasant or it is unpleasant. There is really no one particular cause behind it, whereas emotion has to have a cause behind it. Mood generally stays for a longer time. Emotions move faster, right? You may be happy right now, you may get jealous after some time. So you're really happy sitting in a canteen and the guy you have a crush on is talking to another girl, उसको देख के फटक करके वो jealousy का streak आ गया, another one emotion. And then he comes walking towards you, you have those butterflies of love in your stomach. So mood doesn't change so fast, guys. Okay, so mood and emotions are different things. Okay, yes.
Ma'am, okay, this is the last question, and this is from one of my classmates who asks, ma'am, how to deal with heartbreaks in these hard times when you cannot go out to meet friends and even can't tell about this to your family?
Call me.
Call
Me.
Okay.
No, Ayushi, call me. Tell this girl or boy, whoever. Guys, okay, look at me. I am married to one of the most handsome man in the world who was after my life. Okay, and he's, guess what? He's 5 years younger to me. I keep asking him. Today morning also I asked him, can you tell me something nice about you? He says, मैं सोच के बताता हूँ. So he's younger to me by 5 years, but he's my handsome husband. And guys, I was in love with another guy. 7 years I dated a guy and he did not marry me. Because he didn't have any goals in life, and I don't remember who dumped who, but I think, and I was a mess. We didn't have COVID that time, but I was a mess, a walking, talking clinical psychologist, heartbroken in love. हिंदी मूवी सुन के रो के, वो कौन सा धड़कन पिक्चर, वो सुनील शेट्टी और वो शिल्पा शेट्टी की कौन सी पिक्चर थी, मैं इतना रोती थी. And guys, I'll tell you the worst scenario. Whoever's asked this question cannot be worse than me. This guy and me used to study in Bombay University. Okay, we were dating when we were both students. That time I didn't know I want to be a teacher. Okay, 20 years later, I am a Bombay University teacher. Every time I go to Bombay University, every watchman asks me, भैया कैसे हैं? भैया कैसे हैं? In front of my husband. And I tell him, अभी ये भैया है, वो सैया गए. ठीक है? And to even worse it, I'll tell you, he is also into teaching profession, I am also into teaching profession, and so many times I meet him on a common platform. Yes, and people around me knows कि अरे बाप रे, 7 years they were having an affair, but you have to deal with it, right? So whoever can't handle, call me, I'll tell you how to handle. ये तो मेरा एकदम favorite topic है, and you will become a master. My crash proposes my best friend, then I call him भैया. Yeah, call him यार, big deal. बेस्ट फ्रेंड को प्रपोज किया, ठीक है लेके जा, मेरे को और बेटर मिलेगा. आई एम टेलिंग यू गाइज, नो बडी इज इंडिस्पेंसिबल. My husband is much better looking, and oh, the best fun guys, I'll tell you, when I meet on a common platform, I tell my husband वही वाले boyfriend को hi बोल, and then he'll tell him, अरे मेघना my love, you're so cute, and it's fun. Okay, so कुछ नहीं होता है गाइज. हमारा जब ब्रेकअप होता है ना, हम सोचते हैं कि माय गॉड लाइफ इज ओवर, अब कुछ नहीं होगा, कभी प्यार नहीं होगा. बार बार प्यार होता है गाइस, बार बार प्यार होता है. यू विल फॉल इन लव, यू विल गेट अ नाइस पर्सन. जो गया उसको जाने दो, ठीक है. बट अगर वापस आना चाहे तो इतना टफ टाइम दो कि 10 बार सोचे. डोंट गिव इट ईजी ऑल्सो. Okay, but anyway, that's one topic. Anybody can call me anytime. Okay, don't call me post 9 o'clock. Call me because that is the time I see my Anupama and I dream about them. But anytime anybody wants to talk, I'm ready to talk. Okay.
I believe we still have 13 minutes left. So if right now anyone wants to use this golden opportunity and turn on their mics and ask any of the questions they want to, they can.
I fall in love almost 3 times, but I'm single. Doesn't matter. Life is so young, guys. I got married when I was 38. Right? 30, no, 6, 35. I was 35. So it's all right. You've fallen in love 3 times. You have so many years to go. Another 3, 4, 5, 6, 7 times. Okay? Anyone else?
I guess everything has been answered.
Yeah. So I was waiting for these love questions to come. Yeah, because this is the age, you know. He doesn't love me and I love him, and he loves someone else. How do I win his love? Don't win anybody's love. If he loves you the way you are, that's good. If he doesn't, you can take a hike. He or she.
Ma'am, if you don't mind if I would pose a question, right?
Absolutely.
Yes.
Go ahead.
So,
Yes.
Ma'am, I really liked one of the quotes in your presentation, that healing is not linear, right? That the path is different for everyone. And definitely during the pandemic, everyone has had a different experience. And yet there's also a universal experience of everything just stopping, or that feeling that nothing will get better. But at the same time, you have social media where you see people every day who are doing much better. And how do you deal with these feelings of jealousy or feelings of inferiority that you're not doing enough, but still be happy that, you know, every day I get up and I'm putting my best? So just striking that balance, I think, if you could give some guidance in that.
Absolutely. So Samriti, I'll give you a personal example. Of course, you can see from the screen that I'm highly obese, and I've never really thought of losing weight from point of view of looking good, but because, you know, there's so many health issues come, and with COVID, you know, you kind of get stricken that कुछ serious हो सकता है. So there's this, I'm sure you've seen online fitter बोल के कुछ है, FITTRR, and lot of people, my God, every day I open Facebook and people have lost 35 kilo, 20 kilo, and they say मैंने खाली sprouts खा के lose किया, कोई बोलता है मैं धनिया पानी पिया, ये वो. And my husband has suddenly gone on this trip कि every day he'll tell me that you must lose. And पहले पहले तो कहाँ कहाँ से वीडियो लेके आता था कि देखो ये इसका वीडियो देखो, ये इतना हो गया, ये देखो तुम्हारे जैसा ही है, उसकी इतने भी कोमोबिडिटीज है. Of course his intention is again because my diabetes and all. And then one point I told him कि मेरे से नहीं होगा, I don't want to follow fitter. Of course he keeps telling me that you can do it, and these are stories. He must have shown me some 200-300 in this 2 years, 200-300 stories of people. And then I keep telling him, one, initially I used to feel what you feel, that oh my God, so many people are doing it, why can't I do it? Okay, and I feel terrible guilty, I have low self esteem. और मैंने जाके इतने सारे चिया सीड्स, फ्लैक्स सीड्स सब लेके आई कि मैं भी सब डुबो डुबो के पी 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 के पतली हो जाऊंगी. And then I just realized that copying somebody is not going to help me. It has to come from within. Do you understand what I'm saying? You learn from examples, Samriddhi, but like I said, everybody has a different way of dealing with it. So I just felt that all these people have done all that. I am going to take the most of me not traveling outside the house for mental peace, because I am a very stressed person. When you do so much of work, you do get stressed out. So I decided that these 2 3 years I'm just going to enjoy my work from home. um, Mentally I'm just going to be very relaxed. चिया सीड्स अगर मन किया खाएगा तो खाएगा, और अगर मेरा 10 किलो कम नहीं होता है चलेगा. आई एम मैरिड and my husband loves me, touch wood, okay, as of now, okay, touch wood, let me touch wood, huh? So don't feel low self esteem that you are not being able to do what others are doing. You do your bit what you like, because only when you do your bit what you like will you enjoy and will you be passionate and you will be committed. If you try to copy others, i i I don't know, maybe it works for people but it doesn't work for me. Okay, I don't know, does it answer your question, Samriti?
Ma'am, it definitely does.
Yeah, so
And I'm
whatever
much.
you are looking at, take inspiration, try and do what others are doing if you feel that is helping you, but you don't need to copy it and you don't need to be like them, because that's another game by itself. Most people who want to be always like others want to be, and no, it doesn't work. I'll give you one example, Sumriti, okay, how I make my feel self good. So I am a 49-year-old mother with a 12-year-old son. My son goes to an international school, and where all the mothers are the hoity-toity. Can you see me? The way hoity-toity, all French manicure, and they have their Gucci hanging, and when they stand outside the school, they're like, oh, there, okay. And I come in one auto, okay. I tell that auto wala, सामने किसी इंसान को मारना मत, बट रुकना मत, हवे के जैसे जा. फार माई सन सीज मी, मैं जोर से सीटी मारती हूँ, ठीक है, बहुत बार सीटी मारती हूँ, एंड मैं उसको बोलती हूँ दौड़ के आ, जल्दी आ, मेरे को देरी हो रहा है, मैं तेरे को ड्रॉप करके आई गो टू माई नेक्स्ट वर्क. ओके, माई हेयर इज फ्लाइंग, लिपस्टिक तो है ही नहीं, ठीक है. कभी अगर मेरे को ऑटो से उतरना पड़े, आई एम स्टैंडिंग, आई लुक लाइक अ भिखारी in front of these Gucci bag mothers. Okay. So my son told me once or twice, Mama, don't come to school to pick me up. Okay. 2 3 times he says, why don't you comb your hair and all. Then I told him कि बेटा sit. Then I told him कि वो जो आंटी है ना, आंटी हर्ष की मम्मी, वो जिस BMW में पिकअप करने आती है, वो BMW हर्ष के पापा ने खरीद के दिया, राइट. हर्ष के मम्मी ने ब्लो ड्राई करके पार्लर में करके ऐसे जाके खड़ी हो गई. आज तुम्हारी मम्मी ना जितना कमाती है, वो 4 BMW ऐसे खड़े कर सकती है बिना पापा को पूछे. गॉट इट? सो दैट इज व्हाट योर मदर इज. योर मदर इज डॉक्टर मेघना बासु ठाकुर, और वो डॉक्टरेट ना मैंने खुद लेके आई हूँ. तो तुम्हारे जितने ऐसे हॉइटी टॉइटी लुई विटॉन मदर्स है ना, उनके सामने अगर मैं खाली जाके अपना डॉक्टर का हिस्ट्री बता दूँ ना, सब ऐसे ही बैठ जाएंगे. दैट इज व्हाट योर मदर इज. यू अंडरस्टैंड? सो दिस मेक्स मी फील, you know what शाहरुख खान says, when you see in the mirror, feel like a tiger. तो मेरे को अगर तुम IIM के सामने भी खड़े कर दिए ना, मैं तो उनको देख के बोलूँगी कि भैया चल तू इंटेलिजेंट है, मैथ्स में तू मेरे से बेटर है, इसलिए तू IIM क्रैक करके उधर बैठा है. मैं नहीं हूँ, पर मैं भी मैं हूँ. सो ऑलवेज टेल योर सेल्फ आई एम द बेस्ट. ठीक है, थोड़ा बहुत स्किन अच्छा नहीं है, थोड़ा बहुत वेट 10 12 20 40 किलो ज़्यादा है, ठीक है, बिग डील, ठीक है. Okay. Yes.
Thank you, ma'am. And I think we've had a very interesting question. What if your parents don't let you do anything, especially like now that you enter into adulthood and you want to do a lot of things on your own, and because of pandemic, you have to be in that small space with everyone. That negotiation, if you could guide us on how to deal with
Absolutely. Now this is very important, guys.
Sorry to interrupt, ma'am, but we will have to keep it short because we are running out of time.
Absolutely. Great. So guys, this is where what Samriti has already said, you need to sit down and talk to your parents. You have to convince your parents to dream what you're dreaming. I can't tell you what I did. I ran away from home. I didn't run away like Dilwale Dulhania. My father, mother wanted me to become IAS officer, and I wanted to do psychology. I left Calcutta, I came to Bombay, took hostel, did tuitions years back. If you can do that, if you're confident, do that. Pursue your dream, because if you pursue someone else's dream, you'll never be happy. But nowadays I think kids are very smart. Sit down and talk to your parents, or make them talk to me. Make them talk to me, guys. I will convince them. But I'm telling you guys, you all are the best negotiators. Convince your parents that what dreams you all have is a dream that is meaningful. Convince them that you all are happy in the dream. Convince them that what dream they have is not wrong, but it's not what you have. Yes, and that may not happen overnight. Don't give hope. 3 चीज हमेशा अपने पर्स में रखना, लिपस्टिक और परफ्यूम और कंघी के साथ. होप, ऑप्टिमिज्म एंड रेजिलियंट. वेरी इंपॉर्टेंट. जिंदगी इज नॉट अ बेड ऑफ रोजेज. यू विल फॉल, गेट अप एंड बी रेजिलियंट. You have to bounce back. Yes, so convince your parents. You're their children, guys. Come on, they have to listen to you. Yes. Okay.
Thank you once again, ma'am, for taking the time out and answering all our questions and for equipping us with all these essential tools to deal with the pandemic. Also, please check that the feedback form has been put on the chat, and do go there and fill in the feedback. Now I call upon Ayushi Tomar to give the vote of thanks. Thank you.
Thank you, Samriddhi.
Good afternoon, everyone. Ma'am, I hope this would continue for so long, but we have time constraints and we have to end it soon. So it's my privilege to propose a vote of thanks on this occasion. I am Ayushi Tomo, Vice President, Sankhya, Department of Mathematics, Miranda House. On behalf of all the department students, extend my gratitude to you, our Honorable Speaker, Dr. Meghana Basu ma'am, for taking out time from your work commitments and gracing us for this event in spite of your ill health. A big thank you for your efforts, ma'am, towards the title for today's session. Thank you, ma'am, for sharing such enriching knowledge about mental health and resolving our issues regarding the same. What I personally take up from this session is hope, optimism, and resilience. Your emphasis on positivity in life and disconnecting with toxic people are the best things that I would be taking up. I would like to thank my co-union members and dedicated volunteers for their involvement to make this session successful. I would also like to place on record a hearty thanks to our college counselor, Dr. Alpna Rastogi ma'am, for her cooperation in the organization of this session. Kindly find her contact on the screen. You can freely reach out to ma'am in case of any help. Last but not the least, I would like to thank our audience for attending the event so patiently. We hope you found this session informative, relaxing, and I hope you enjoyed. Once again, I want to say that we are all most grateful to you, Meghna ma'am. We thank you for being with us this afternoon. It has been a great pleasure listening to you. Thank you so much.
Thank you so much, Ayushi. I must tell you guys that I have gone through a lot of talks, but the way 6-7 of you have, framed this, the way the whole formal and informal, and the preparations that you all have put in, very well done. I mean, kudos to you, and I think this is all about personality development. All of you all look beautiful, and I always envy, how Delhi people dress up, and especially this is Ayushi is wearing all her, those winter wears, and I had my sister in Vasant Vihar for 5-6 years, and like I said, when Bombay people go in front of Delhi people, we always take a second stand. But it's been a pleasure. Shruti, you can personally call me. I think my phone number is there with maybe Manisha.
Yes, ma'am.
Ayushi,
We'll share
if anyone wants it, please share it. Anytime you need to reach out, I may not respond immediately, but I will respond because that is my ethical thing. And it's always been a pleasure. And believe me, guys, whatever I've said it a lot from my personal experience. Life is beautiful. Don't expect कि problems नहीं होगा, because फिर जिंदगी में वो मज़ा और स्पाइसी नहीं है. जितना प्रॉब्लम उतना स्पाइसी लाइफ. Live with it, deal with it. You will all become resilient people. Yes. Have a lovely
I
weekend.
just want to say one thing over here, that I think this is the best session that I have attended personally. इससे अच्छा ना तो मैं YouTube वीडियो देख सकती थी, ना मैं कोई मूवी देख सकती थी. Best relaxing session.
Thank you, Ayushi. I to tell all my students also, so many of them have gone and broken up with their boyfriends. Said, Meghna ma'am ने बोला है breakup करो. I said, ये मेरे घर के बाहर सब लाइन लग जाएगा, ऐसे मत कर. But live life full size. I'm telling you from my experience. I will write a book one day, The Fat Person's Broken Life Story, and I'll put lot of masalas in it. But live life, guys. We are young. You all are all in that generation of being beautiful. So enjoy life, enjoy every experience, study, दबा के पढ़ो, जब एग्ज़ाम होता है फिर भूल जाओ, एंड दबा के करियर बनाओ और बहुत पैसा बनाओ और बहुत शॉपिंग करो खुद के लिए एवरी डे. आई डोंट डिसाइड, आई टेल माई सेल्फ एवरी, आई शुड नॉट रिपीट सलवार कमीज़, भले वो 20 रुपया का सलवार कमीज हो, बट इंजॉय योर लाइफ एंड लिव इट मैक्सिमम. हैव अ गुड वीकेंड. थैंक यू फॉर
Thank you,
इनवाइटिंग
ma'am.
मी
Thank you
एंड
so
ऑलवेज
much.
अ प्लेजर. Thank you guys. I'm going to log off. Yes.
Yes, ma'am. Thank you, ma'am. Thank you, everybody, for joining in.